Hello, and welcome to School Health Presents, working with our exceptional individuals during the COVID-19 pandemic. This particular video is going to focus in on taking this pandemic and turning it into a learning experience for our students. Notice I didn't say positive there. It is not necessarily positive any way you look at it, but it's a real life experience that, when presented the right way, will actually allow our individuals to move forward and take a differentiated look at life, which will be more healthy for them in the long run. So this video today is looking at how do we present this particular pandemic to our individuals with any type of exceptionality, and how do we make sure that it's a balanced approach? Well, first and foremost, we want to address the whole issue of hygiene. I know that sounds strange to start with, but guess what? Whether you're listening to the CDC or physicians or other healthcare specialists, you keep hearing one phrase: wash your hands. This is a great way to emphasize to individuals why it's so important to wash hands. Now, people have asked me, what's the best way to make sure that people are washing hands? It's interesting, as I reached out to a retired school nurse, she shared with me that back in the late 60s and early 1970s, nursing schools used to promote the idea of hand washing to nurses in the correct time frame for washing it by simply saying this: pick up the soap, make sure your hands are wet, and you're rubbing everything together in your hands, get the lather all up, put the soap down, and then continue to rub your hands while singing happy birthday. It sounds simple, but think about the psychological side of that too. As we're rubbing our hands together, if we're singing happy birthday, the focus is not on rubbing our hands together. The focus is on the excitement, the positive nature of that song. Now, I realize for some of us who've been around for a while, happy birthday to us might not be something that we want to hear. However, for our individuals with exceptionalities, it is. And so that's a great idea to use. How long should I wash my hands and rub them together? Sing happy birthday to yourself. And then when you're done, rinse your hands and you're done. What kind of soap? That's the next thing I get asked a lot. That depends on the individual. Again, we're dealing with individuals that may have differentiated types of sensory processing issues. And so it's hard to say. Find what type of soap works the best. For some individuals, and I've seen more and more individuals going to this, they prefer the foaming soaps that come into play. So if you're using a foaming soap, one of the things that you want to do is work with your individuals and tell them they want to paint their hands, completely covering that in that foam. Once they've covered their hands, then start singing happy birthday and rubbing everything together very well. And then at the end of happy birthday, rinsing your hands. If you're using a liquid soap, again, the same type of idea. You want to make sure that they're rubbing the liquid soap and remind them, get in between the fingers. Make sure that you're going through and you're rubbing that liquid soap all along the fingers. Once you've rubbed everything in at first, then again, sing happy birthday to yourself while you're rubbing it in even better, and then rinse your hands. If you still have individuals, and oftentimes this will be our adults with exceptionalities who prefer bar soap. Again, the same type of idea. Have them wet their hands, get the bar soap, rub it a little bit all over their hands so that now it's foamed a little bit on their hands. Once they put the bar soap down, then it's time for the rubbing and singing happy birthday. So very simply, hygiene-wise, remind them about how to wash their hands and give them an idea, something like the happy birthday song. It's not limited to happy birthday. It could be one of their favorite songs. Tell them to sing a verse of whatever song they like. The idea is to get them motivated to actually have this action and yet create in their minds a set time frame where that can end. The next thing we want to talk about is cleaning up after oneself. I know that's an issue with a lot of individuals. There's a lot of different things going on, and unfortunately right now on the store shelves, it's very hard to get any type of cleaning supplies. But as we come out of this and the cleaning supplies come back, some things to keep in mind down the road. When you are using any type of cleaning solvent, so whether it be alcohol-based or bleach-based or any other base that actually is going to kill germs and bacteria, what you want to do is, again, recognize those different types of sensory inputs going in. So what I've seen over the course of the last 2 years is a lot of groups moving away from more of the bleach-based types of wipes and cleaning. Why? Bleach has a distinct odor. Bleach also is not good if an individual automatically picks up something, including their hands, which has been resting on it, and puts it in their mouth. Another thing is that bleach does leave a residue, especially if you're cleaning something that's glass. There'll be a residue on it that can actually cause our individuals to kind of flinch, because that residue may be something that triggers some type of sensory feedback. One of the alternatives that in these last 2 years have come up that have been very strong is any type of a wiper or cleaning agent that has hydrogen peroxide as its base. Why? Well, a couple of different things. The scent is somewhat different. The feel on your hands is different when you're using those wipes. Those of us who've used bleach wipes before know that sometimes there's a strange kind of slick feeling on our hands. This will also have a feeling, but it's more an alcohol type feeling as it's coming off. But what I like about hydrogen peroxide as a basis for anything is the fact that hydrogen peroxide is used for a lot more than just cleaning. Bleach, cleaning. You clean your whites with bleach. You clean anything that has, major dirt with bleach. You might clean around the house with bleach. But with hydrogen peroxide, various forms of it actually can be used for things like cuts. If you've got a cut, you pour a little hydrogen peroxide on it. It'll bubble up. And sometimes for our individuals with exceptionalities, that's a cool thing to watch. It might hurt a little bit, but it's cleaning as we go through. The other thing about hydrogen peroxide that we sometimes forget, if we're concerned about individuals putting things in their mouths, hydrogen peroxide is used by some dental care individuals for whitening teeth. It's also used by some medical professionals for conditions that require some type of cleansing of the mouth that also is not going to be heavy alcohol based. So yes, hydrogen peroxide has been used basically as a mouthwash type gargle in certain situations. So we're dealing with something here in a hydrogen peroxide base that would even allow you to pick up perhaps a sensory item off the ground, wipe it down, and give it back to the individual. Even if we're concerned they might put it in their mouth, that's okay. So it's a way of approach is using hydrogen peroxide as your basis. Again, use what's going to be best for you. But hydrogen peroxide wipes, alcohol wipes, bleach wipes, they all kill 99.9% of bacteria. Another thing we've seen, unfortunately, a huge run-on right now, and it's very hard to get a hold of, are hand sanitizers for when we're out in the field and we can't wash hands, we can't do things like that. Please, first and foremost, do not overuse hand sanitizers. It's far better to be using soap and water on a regular basis, otherwise our hands can dry out. But when you're outside, when you're moving around, when you're traveling, it's not always easy. So hand sanitizers are important. You've got a couple of different types of hand sanitizers. You've got your Purell-based hand sanitizers, which are excellent and still should be continued to be used. But we have some concerns too about alcohol within those types of hand sanitizers. Something I love using and I share a lot with individuals is Safe Hands, because it is alcohol free and yet still kills 99.9% of all the bacteria that's out there. So there are alternatives as we go through. Be patient as we come through. These are things you want to be keeping a list of, but also be working with those individuals with exceptionalities on now. How do we clean up after ourselves? Use wipes. Go through. Even when we transition back, as things resume a state of what we might refer to as normalcy, Our individuals will be going out to places like fast food restaurants and regular restaurants. And yes, we need to get back to those because those are places that there's a comfort level with. And it's important because in many of our restaurants, you can get some excellent food choices for those individuals that cannot cook for themselves. Once they get back into that, one of the things that you want to work with them on is making sure that they still wash their hands before that meal. Also share with them it's okay to go back to those places once we've been given the all clear. And I'll talk about that in one moment. So cleaning up after oneself, using sanitizer at the proper times. Another thing that you want to be aware of are gloves. For some of our individuals, as they're doing some cleaning, they're going to need to have gloves on their hands. Make sure you have a supply. Practice with them. What does it feel like to have a glove on? Make sure that if you're dealing with individuals that have certain types of allergies, you're getting latex-free gloves as you go in. Don't be afraid to ask restaurants too for those individuals if they do food preparation with latex-free gloves. And if they don't, you may have to go to another restaurant, but know that there are chains that have specifically gone to latex-free over the last 3 to 5 years because of a greater awareness that we have of allergies. So work with your individuals too. If you've got some gloves around, put on the gloves. Let them feel how the gloves feel. Let them do some simple activities, even something like writing their name if they're able to write with gloves on. Why? Because we want them to understand that something like this is not to be feared. If it's being used in the proper way, all of these are great tools that help us then deal with life. Now, the final thing I want to bring up doesn't have to deal with any of the items that you might be using, but approaches to the individuals. I've had a lot of parents especially calling me concerned. What do we say to our exceptional individuals? Here's what you say. First and foremost, be honest, but also deal in facts. What do I mean by that? What I mean is that you need to let them know that this is a sickness that's out there that a lot of people can catch. Now, the question comes into the whole idea of dying. How does that fit in? We don't want to create a higher sense of anxiety in any of our individuals, especially those with exceptionalities. So stick with the facts. What do we know from the CDC at this point? We are looking at COVID-19 as being something that causes conditions that can lead to death. We've seen that in about a little over 3% of the identified cases to this point. Notice I said identified, because we will be seeing more identified cases. We'll also be seeing less of a percentage of deaths as that goes on. A lot of people don't realize, but globally, on the average, your standard influenza will actually lead to conditions that will cause death in 0.3% of the population that had that influenza. Death occurs with various types of sicknesses. Death occurs to a lot of people. And so we want to keep things in perspective. Yes, if we're not taking care of ourselves, something like this can eventually lead to death if we're not careful, if we're not cautious, if we don't share when we're not feeling good. Approach it that way. Don't approach it, as I've seen, unfortunately, some people discussing it, where if you don't do these things, or if somebody's coughing, get out or else you'll die. No, that's not real. Once we get beyond this pandemic, there will still be people that sneeze, that cough. There will still be those respiratory droplets that come out even when we're excited and talking to people. And that's okay. We don't want to create that continued mindset. For many of our individuals with exceptionalities, again, what is learned here will be applied to later life. That's why we need to keep that balance. That's why we start with hygiene. That's why we start with cleaning. If you want, go into nutrition. What's good? What's healthy to eat? Why should you not do things like drink out of somebody else's cup after they put on put their cup to their lips or their water bottle to their mouths. These are all things that we would have thought in the past were common sense, but aren't always necessarily represented that way. It's time that we stop looking at this idea of what's common sense and do what's healthy. And what's healthy is working with our individuals and telling them day-to-day life is of the essence. It's a beautiful thing, but we have to protect ourselves. And so as we go through this, as we go through all of this together, as I'm sharing this with you from my house, and you're sitting in your house, or you're sitting in an office place somewhere, know that we're all in this together. But it's how we approach things that is best going to assist those with exceptionalities. So start with hygiene, start with hand washing, move to cleaning, talk about how those things work together. Talk about the facts. The facts are a lot of people may catch this, but it is a scenario that can be controlled and we shouldn't fear it. And then work with the individuals to make sure that they transition all the skills that they continue to learn and go over here to events that happen in the future. Thank you.